I've been fishing since a kid, like forever. I just love going out there and fishing. And it's just like, it's peaceful.
He was born an athlete. Jumping out of his crib when he was 18 months old. So, yeah.
But I love football. I really just wanted to get a scholarship and go to college and play football and study too. So I went to a party with my teammates, my friends, everybody. And then I just started hearing all these shots. It's like boom, boom.
Furter County 911, what's the address of the emergency?
Urban Green apartment. I was just sitting in here playing a game and I just heard a bunch of gunshots going off. I looked out the window and there was a bunch of people running away from the clubhouse. There was a party going on there.
How many shots were fired?
It sounded like somewhere between 8 to 12. It sounded like it might have even been 2 guns.
And I'm running inside and I just feel it. I feel it in my stomach.
Medic, engine, ambulance, or EMS supervisor. EMS response.
The police already applied the chest seal, and Chase was conscious, alert, very diaphoretic.
I wasn't in no pain. I was just tired. And I'm like, dang, this time I'm about to die?
So our initial blood pressure, I think, was 66/33. He needs blood. I don't think he's gonna make it by ground. As we talked to Trooper 2, and we told him, hey, have your blood unit ready, because we're probably gonna be giving this patient blood transfusion. We knew it was without a doubt that Chase had to go into shock trauma because that was going to be his best chance at survival.
Shock trauma nurse online, do you need a physician?
We are 10 minutes out from your facility. We have a 15-year-old male, gunshot wound to the chest, priority 1 alpha.
So if we'd flown Chase a few years prior, he probably wouldn't have made it to the hospital back when we didn't carry blood. We gave him 2 units of blood before we arrived at shock trauma, and we still never got him to normotensive levels. So he was losing blood pretty much as fast as we were putting it back into his body.
I was in North Carolina moving Chase's brother into college. I received a phone call from Chase's phone, and I thought it was Chase calling me. And then it was a security guard, and he said, "Ma'am, your son's been shot." And I just started crying and praying and just hoping for a miracle.
Chase was, if he wasn't the most badly injured patient we saw that year, he was very close.
He was very scared, and it just holding his hand, just kind of reassuring him, that we're going to do what we can, and breaks your heart, obviously.
He was really on the brink of not surviving, and so this is pretty clear. The answer is surgery, and the quicker you get there, the better the chances are that this works out well.
Where the bullet entered his abdomen hit the liver and the biggest vein in his body at the area that all trauma surgeons hope it doesn't hit.
Chase was bleeding at an incredible clip. He lost 40 liters of blood in his first operative procedure. 40 liters.
Chase had a left diaphragm injury, an injury to his IVC, his inferior vena cava. The bullet also went through the liver. It went through his stomach twice. It went through his right kidney, and it also caused bleeding in his left chest.
We used a very innovative technique. We slid a balloon up from his groin in order to help control the hemorrhage and to just keep him alive during the first operation.
They weren't sure if Chase was going to make it through the night.
When Chase left the operating room, we were trying to keep up with resuscitating him with blood products, fluids, trying to manage all of his drains, chest tubes, do labs, get an assessment, see if he was neurologically intact, just basically trying to keep him alive.
And he started having swelling in his legs, and they were concerned that he could lose the muscles.
We opened up all of the compartments, both legs, both calves, both thighs, in order to preserve the muscle in his legs so that his legs didn't die.
The injuries he suffered were severe, and the fact that he had to deal with them all at once, I think, was his biggest challenge.
The concussive force from the bullet injured his heart. The muscle weakened and then developed a leak. So he's bleeding out of his heart now into the pericardial sac. And this is the first time I've seen this happen in 45 years of doing this.
There was just a lot of things like that where it was like, you think he's getting better, but then it'd go backwards.
So this kid ends up with 8 operations in the first 3 days. He ends up losing the better part of 70 liters of blood. His blood volume 10 times. Gets 150 units of blood product.
He was needing continuous renal replacement therapy, so it's uncommon for a nurse to go down to the operating room to run that therapy. Every time he went down to the operating room, I was with him.
Every one of his organs failed. His kidneys failed, his lungs failed, his heart failed, his liver failed. There aren't many people that use the liver dialysis circuit. We do.
Eventually, he stopped requiring the CRRT, the MARS. His organs were recovering. We were seeing signs that his lungs were recovering, and we started to see a spark in his eye again. With the extent of the injuries that we discussed, a stay of 2 months is remarkable, and I think that's attributable to his youth and the fact that he had such a supportive family at his bedside day after day.
One of the things I often tell my patients are like, I know that this is a really scary time, but you're in the safest possible place that you can be.
I couldn't even talk. There wasn't even anything I could do. I was just like, it is what it is.
With my role, I get to really dissect those feelings. That takes the shape of like playing games, talking about our feelings, remembering what's important and what we're gonna do when we leave.
The trauma team, critical care, cardiac surgery, physical therapy, occupational therapy, speech therapy, respiratory, nursing, ENT, the list goes on and on.
I've seen some wonderful things. Just every service, every aspect of the system, everybody moves mountains to make things happen for the patient.
The best. The people there were, makes me emotional think about it. They took really good care of Chase, and I knew he was in good hands.
Shock trauma is the reason that our patients are still alive, and now it is our job to pick up from where they left off and help them get to that next step, which is going home.
Our goals for Chase were ambitious because his goals for himself were ambitious. We wanted him to walk within the first few weeks that he got here, and by week 3, he started to take some of those steps with a walker. And by week 6, he was walking without anything.
Chase and I did a lot of like doing Legos together, video games, and what might seem very like mundane is actually a time to just enjoy being a teenager.
I got to see Chase a lot in our outpatient clinic for follow-up. For the first couple of visits, he was coming in via stretcher, and then he was walking into our clinic, and he's talking about going back doing sports, and then now he's like out in the world living his life, which is amazing.
Seeing a patient go from a very debilitated condition with a lot of medical problems and weak and not able to do much for themselves and be able to walk out of here is why I come to work every day.
The medical miracles and just their care, and we appreciate them so much. Chase wouldn't be where he is today without them, so we thank them.
I want to say thank you to all the people who helped me and saved my life.